Sickle cell is a lifelong condition that can cause severe pain, organ damage, and even premature death. Though still considered rare in Europe, its prevalence is rising, and yet, across the continent, specialized care remains fragmented. Too few expert centers, too few services, and a major gap in national recognition. One of the most critical and too often neglected moments in the patient journey is the transition from the pediatric to adult care. This isn't just a hospital transfer. It's a pivotal shift that demands preparation, support, and empowerment. And that's why we launched the Sickle Cell Transition Policy Lab to make transition work for young people living with sickle cell disease.
My own experience with transition, I would describe it as non-existent. Although I had a clinical handover, I had no idea of what to expect outside of just going for appointments and seeing my hematology.
The word I would use would be non-existing. I've never had a transitioning, and I didn't even know that it was a thing within sickle cell until I met other patients who had experienced the same thing.
Patients with sickle cell disease have significant problems and we need a holistic approach to provide the best care. Unfortunately, there is no common universal guidelines for this transition process.
Currently, I would describe the transition process as complex, fragmented, and vulnerable.
At the moment, what I can say is that we don't always get it right. There are some problems.
Despite our dedicated team, primarily due to limited resources and time constraints.
Happy to see that some things have changed in a better way, but I still see that we have a long way to have like the best transition ever.
I would love to see a change within the next generation.
I would like to call it in the future as empowered, coordinated, and patient-centered.
A seamless transition for all the young people who are transitioning and moving their care from pediatric services to adult services.
I would want transition to look like to be more holistic, preparing young people even before they're at transition age that this is something that's going to happen.
I envision a more structured and gradual process with well-defined stages that offers reassurance to both patients and healthcare professionals.
They emerge from being immature and hesitant, perhaps scared and feeling underprepared teenagers into becoming fully confident, independent, responsible, capable adults.
It would be great to have a real program transition during years when the patients are teenagers to make sure they are autonomous enough to enter into the adult hospitals.
I would also really love to see more of a focus on like a person-centered care approach that includes multidisciplinary teams such as mental health, other areas outside of just sickle cell that might be impacting that transition experience for the young person.
Working towards a common goal that is empowering the patients and making a patient journey better, that really makes me feel like change is possible.
Our project brought together patient advocates, young people living with sickle, clinicians, psychologists, and policy experts from across Europe and beyond. Together, we co-developed the Charter for Optimal Care Transitions in Sickle Cell Disease, a practical roadmap to ensure that every young person with sickle cell can experience a safe and continuous transition. So by harmonizing care across Europe, we can empower a new generation to move through life with confidence, autonomy, and dignity. So the knowledge is here and the tools are ready.